Welcome, this is the presentation of my scientific article. Measuring perfusion index for the upper extremities before and after a spinal manipulation of the segments T1 to T4. Author and speaker Alexander Backe. Promoter Michael Metz. This is the paper to obtain the title DO Diploma in Osteopathy. Academic year 2015-16. The purpose of this study is to investigate whether osteopathic manipulation, high velocity, low amplitude thrust of the segments T1 to T5 will result in difference of vascularization of the upper extremities. Measurement of vascularization was taken before and after treatment by use of an oximeter in order to see any potential improvements. My hypothesis was to see if there was a difference or not. According to arterial rule, osteopathic manipulation technique normalizes fluid flow. By increasing the arterial, venous and lymphatic flow, you will increase the autocorrection. Osteopathic manipulation is a well-known treatment strategy for somatic dysfunction, using high velocity, low amplitude thrust, which is one of the most used techniques. The aim of the high velocity, low amplitude thrust is alternately to restore joint movement, elevation of the muscular spasm, stretching of the capsular ligamentous retractions, increase vascularization and improve body function to create homeostasis in the body. The possible audio cracking sound after a high velocity low amplitude thrust is not necessarily a sound of success. A high velocity low amplitude thrust can be just as successful without any sound. The autonomic nervous system innervates the vascular smooth muscles of the arteries. It is mainly controlled via the ramus vascularis sympathetic nervous system. The vascular smooth muscles are innervated via the adrenic receptors alpha 1, alpha 2 and beta 2 sympathetic nervous system. While the parasympathetic nervous system innervation is through the muscarinic receptors M3, and the alpha 1 and alpha 2 receptors causes vasoconstriction, while the beta 2 and M3 causes vasodilatation. The beta 2 adrenic receptors primarily innervate the skeletal muscles, while the alpha adrenic receptors innervate arteries of the skin. Studies show there is a significant relation between the autonomic nervous system and vascularization. High velocity, low amplitude affects the autonomic nervous system, resulting in a neurovascular improvement. My study design was carried out as a controlled, quantitative, quasi-experimental design. Examination to find a somatic dysfunction, test by the oximeter, intervention by performing a manipulation, and then retest with the oximeter. Ethics. The ethic guidelines from the Declaration of Helsinki was kept during this study. Written and verbal information was passed on to the subjects and they could at any time withdraw from the study, without questions. The subject integrity was respected at all times. A written consent was declared and all test results and personal data was handled anonymously and confidentially. This scientific article was proven by the Ethics Committee at the International Academy of Osteopathy. A total of 40 subjects participated, 7 females and 33 males, ages 20 to 43 years with a mean age of 31.1 years. All subjects for this study were drawn from the same population. They were recruited living in or nearby Copenhagen, Denmark, and at the same time fulfill the inclusion or exclusion criteria. For the intervention group, the treatment consisted of a high velocity, low amplitude manipulation of the monolithical block or blocks using dog technique for the thoracic spine, T1 to T5. In the control group, the subjects were placed in the same position but without a thrust. Material and method. An oximeter contact CMS S50H pulse oximeter was used in this case for measuring the perfusion index. The participant had a perfusion index of the second finger measured lying supine. The participants were told to lie completely still and measurements were taken. The measurements were done in a quiet room with no external stimuli and a steady temperature. The participant lied still for 2 minutes before measurements was taken. The perfusion was measured for 6 minutes before intervention and again 30 seconds after intervention, measuring for 6 minutes, recording results every 30 seconds. Randomizing. The subjects were randomized, divided in 2 groups, intervention and control, with an allocation ratio 1:1. A simple random sampling method was used. By subjects drew a number from a black purse. All equal number was in the intervention group and all unequal number was in the control group. The examiner conducted the randomization. Blinding. The study was carried out as a single blinded study, as only participants were blinded for the group allocation. The author of this article performed intervention in both groups and collected all data. The data analyst was blinded. Statistical analysis. Excel was used for data analysis and collecting the data. R Core Team 2012 was used for analysis, and the Shapoverics test and the two-sided independent test was used to compare means of the two groups. 40 subjects were randomized in either the intervention group or the control group. The two groups were consisted statistically similar at baseline, as no significant differences were found in the terms of age, gender, weight, height, body mass index, type of lesion, or perfusion index. The intervention group had a significant total mean increase of 0.28 in the upper extremities compared to the control group. In the intervention group had a mean increase of 0.59 after the intervention, and for the control group was 0.31. What does the results mean? It means that we can reject the H0 hypothesis. High velocity, low amplitude thrust has an effect on the vascularization for the upper extremities. The intervention group had a significant total mean increase of 0.28 compared to the control group. Bias. The control group also had a slight increase of perfusion index after the intervention of 0.31. The first 2 minutes of the perfusion index increase for the control group before it stabilizes. A bias could be that the subjects were not relaxed enough and the perfusion index had not stabilized. If you don't take the first 2 minutes into account, and the perfusion index before the intervention is 6.7 and after 6.8, which will give you a mean increase of 0.1. This indicates further that there was no increase in perfusion index for the control group after intervention. The intervention group will then have a significant total mean of 0.478 compared to the control group. This means that the high velocity, low amplitude thrust have an even bigger increase of vascularization for the upper extremities. Considerations. The result of this study caused interest for additional research. This study only examines what happened in the first minutes after spinal manipulation. Time could be of influence. Measurements was only conducted for 6 minutes after intervention. Some studies show that after 20 to 30 minutes there is an increase of perfusion index after successful peripheral nerve blockage. Local vasodilatation and increased local blood flow occur as a result of the blockage. Further studies will have us show if there is a long-term difference in perfusion after spinal manipulation. A larger sample size and more parameters are needed than circulation is the needed examination exact influence of high velocity low amplitude of the sympathetic and vascular system. More randomized clinical trial studies with a control group getting a full osteopathic treatment, including manipulation, mobilization, and muscle energy technique, could be considered. Combining treatment strategies would be interesting for a long-term effect on patients. It would also be relevant to complete a study on subjects with circulatory problems to investigate the clinical relevance. More considerations. Locating a somatic dysfunction has to be studied further to determine the appearance of one and what type of lesion. There is no literature found on a somatic dysfunction if it is a compensation or decompensation lesion and how it affects the vascularization. Does the type of lesion determine the impact on the segment and thereby the neurovascular system? The type of lesion has not specifically compared to the outcome of vascularization in this study. This study has found a significant increase in vascularization in the upper extremities after a high velocity, low amplitude thrust of the segments T1 to T5. This study supports the theory that a difference in vascularization is caused by an increase in the sympathetic nervous activity. Osteopathic treatment can be used to increase vascularization and thereby improve the recovery rate of the tissue. Conditions such as epicondylosis lateralis or other inflammatory conditions in the upper extremities could benefit from this. Thank you for listening.